thank you for joining us for another episode of Real Talk. Today we have someone who is I've known for a long time, and I've watched this gentleman move up the political ladder extremely fast. But he did it in such a way where he kept people always at first. He's always been someone who's been community-oriented. I can say that from my experience with him. Congressman Mark Pocan, how are you, sir?
Hey, very good, Henry. Thanks for having me on.
Well, how's it going with it? Now I guess you're not going back and forth to D.C. I guess, are you stuck here in the Midwest?
I had to go back last week, and I got to tell you, it's interesting trying to fly. I was told there was an article in Sunday's paper saying that Dane County had 100 people fly through the airport last week, and I actually drove to O'Hare, and even out of O'Hare, there was only 2 flights going to D.C., and they canceled one of them on Thursday. So I got out on Wednesday, and I couldn't get home on Thursday because of that, so I got home on Friday. There were 9 people on my plane. It's a different, surreal experience right now, but I'll go back in about 2 weeks to DC. It looks like, assuming they can get some things in place to make sure that our staff are safe and the public is safe when we are coming back.
Oh, that's good. We had talked to Senator Tammy Baldwin, and I told her, I'm like, this must be a whole different life for you. I mean, you're just going back to D.C. every week, coming back. I mean, this must be a whole different world. You actually have to be in one place for a long time.
The best part is I wear flannel every day. I do my laundry, and it's like 7 flannel shirts. And, but I put them all back on the next week. So I do enjoy not wearing a tie. I got to.
Hey, you look good in the suit, though. I saw you on doing something the other day, and you're like, oh, you look good in the suit, though, Mark.
Yeah, but this, if they made a flannel suit, I would probably buy it.
Yeah, you're a Wisconsin guy. There's no question about you're a Wisconsin dude. Yeah, So tell us what's going on with COVID-19. I mean, I hear a lot of things about testing going on. People really want to reopen the government. We want to open the country. Where do you stand with all that?
Yeah, well, first of all, I mean, in the state of Wisconsin, I fully support the governor's safer at home efforts. Until we are medically able to reopen, and that's what the governor is waiting for. I think even the president's guidelines say 14 days of declining virus cases in your state is when you're safe. But even then, we've got to do a whole lot more: increased testing, contact tracing, isolation for people who do have it in place to actually be able to reopen safely. So, in Washington, we know Donald Trump has done a pathetic job in dealing with COVID-19. I could talk for hours just on all the things, the missteps he made. Before we came back about 7-8 weeks ago now from DC, I had regular meetings with Dr. Fauci, with the FDA Commissioner Hahn, with the NIH, with the CDC. I mean, those were all through my subcommittees on appropriations. And back 8 weeks ago, I believe it was, could even been longer, Dr. Fauci said if we closed down the whole country for just 2 weeks, we probably would have got through this. Well, we didn't do any of those things. And here we are now, 50,000, 60,000 actually deaths later. And we still don't have a national plan. So because the president doesn't have a national plan, and because he's not using the Defense Production Act to get us the personal protection equipment and reagents and test kits we need, we're kind of on our own as a state. So I've spent a lot of my time trying to help the state get the supplies they need, trying to make sure that we're working in every possible way to get testing ramped up here. We have some very unique things here that I hope the governor is going to take advantage of, and from what I understand, he is. But having Exact Sciences and Promega, making reagents and doing test kits, it's a game changer. I just talked to a colleague, Peter DeFazio from Oregon, 15 minutes ago. And I mentioned that Exact Sciences right now can do 60,000 tests a week, and they can ramp up to 120,000. And we're only doing 2,000 or 3,000 a day right now in Wisconsin, and we have to triple at least the number of tests to be able to safely reopen. In our own backyard, we have this tremendous resource that state of California is contracting with them for a few weeks right now for 20,000 kits. But we really can get and be a Midwest, if not a national example of how to do this right. If we start ordering tests in nursing homes and long-term care facilities, start making sure that everyone who works as a frontline worker in a hospital a clinic, police and fire are all tested. Make sure that every clinic in the state, no matter what you come in for, are getting tested, because that's what we have to start doing to know who has the virus and who doesn't, and then how to make sure that we're stopping the connections with people who are sick, because a lot of people are asymptomatic who get this. So I think most of my time these days is either fighting with the federal government, trying to get supplies we need in Wisconsin, or trying to take advantage of this resource we have here and figure out how we can reopen safely in our state, and also working towards the next CARES package, the CARES 2 package, which will be in about 2 weeks, to make sure we're picking up everyone who got left behind, that we're continuing to do the mitigation that we need to, making sure that people who've lost a job through no fault of their own, or through the small business who's had no business through no fault of their own, that people are made whole so that we can get through this all together.
Yeah, for CARES Act too. What are you hearing from people? Because we heard a lot from small businesses talking about how unemployment was impacting them. Basically saying that some of them were saying that their employees are actually getting paid more to be unemployed than they would actually be working. I've heard that. I think the last PPP program addressed this issue, but a lot of my Native American friends, Ho-Chunk or NIDA, were saying that they couldn't get the funding because of, the 30% was saying if you make more of your revenue from 30%, you can't get the funding. I think that's changed in the last PPP project. But for the CARES Act 2, what are the things you think you guys will try to address that weren't addressed the first time?
Yeah, so there's a number of populations that got left behind, whether it was on the $1,200 check or the PPP loans or the unemployment program. And I think that's what part of it will be, right, is making sure that the intention is to not leave people behind, and we want to make sure people are included. But, we did that fairly quickly in order to get resources out, especially when you put that much in the trillions of resources. We got to make sure we get it completely right, and that's what CARES 2 will do. What's interesting is on the PPP loans, and I think, we put that surge money in for unemployment. One, it shows you people who are making minimum wage, how it's impossible to live on minimum wage and why it's pathetic. It's been a decade since we've raised that in this country, and why we should be at a $15 minimum wage, ramping up to it, because it's the only way, right? And what we're learning is when we did that surge, we put people close to the median income for being, if they're unemployed, so that they can kind of continue to get by. That's where that comes in. But the better thing than giving that is keep people on the payroll. And the way you can do that is either through the PPP program, which kind of works, or you could do a national paycheck guarantee like they're doing in England and Denmark, and then everyone would still be on payroll. You wouldn't be putting money out into the UI account from the federal government like we are right now. And we could be having people, even though we know there's some limited demand in some areas, but no one would be hurt out of this. It's a much actually more cost-effective way of doing it. So we're talking to Speaker Pelosi about that. I'm hoping at minimum they expand the PPP program for more than the 8 weeks, because we're going to need to. And then there's a real important program that I've been talking about too, is the work share program in unemployment insurance. 27 states and DC have it. Wisconsin is one. And this is a bipartisan success, because when they just did the bill in the legislature, Robin Vos and the governor were in the same place. They took every change that I recommended for the program. But what the program is it allows you as a small business to ramp back up, because you're not going to start back at 100% when the governor's safer-at-home order is done for most businesses. I can tell you, my own business, we're probably at 10% of what we're normally at right now, right? But if I can ramp up and start my employees, right now the legal limit, unless we do a federal law change, is at 40% of their hours, and you put your workers at 40%, they can still then also access 60% of unemployment, including that surge money, and have more money in their pocket. So they'll be basically made whole. The small business can ramp up, so they don't have to either keep you laid off or put you on at 100%, which is a very tough decision, because that means a lot of people are still going to be laid off. And it takes away less from the UI account, because the employer is paying someone to do the work that they have. So if I'm trying to get the federal law to change it down to even 20% of work, because even any percent, you're getting your benefits, which is really important, your health insurance, because most people get it through their employer. Not everyone, but most people in this country do. They can at least be working and helping that business. And as soon as business cranks up to 40 or 60 or 80%, you're going to do the exact same thing. But it keeps more money in the employee's pocket. It allows a small business to ramp up. and it saves the UI account. It's win-win-win, but 23 states don't have it. And we got to make sure they have access to it. And also we have to do that little tweak to lower the hours a little more. Right now, the state did lower the hours. They lowered it. Used to be 20 employees or more. Now, as long as you have 2 employees, you can participate. And they're already into the thousands of people that are doing it, when 1 year ago, one business was in WorkShare. So it's a success to help a business get ramped back up.
But the states have to do this, not the federal government, right?
No, we're paying for it. That's the best part. We actually, the last CARES bill said any state with a WorkShare will pay for it completely. So there's no cost to the state, but 23 states don't have it. A couple right now are looking at it. We're hoping more will do it, but we've got some yahoos running states in some places that are opening up already and not really thinking of their citizens. But in a place like Wisconsin, the fact that right now thousands of employees are on it, and really, I think if PPP doesn't continue, you're really going to see people go to a program like that. But it's going to help employees and employers quite a bit.
So what do you say to those, what you call yahoos, who people who in our state of Wisconsin? I can tell you when Governor Evers said the SAFER Act stay-at-home act should extend, I had a lot of my business friends and a lot of our viewers up north get extremely upset. And they were basically saying that it impacts the economy, 1, and 2, people up north like, hey, wait a minute, why impact us up here up north? We have very few cases up here. This is before, I think, Green Bay exploded, right? But we have very few cases, and let us open back up. If you guys want to be in Madison, you guys want to be safer at home, great, but it's not impacting us. What do you say to those folks?
Yeah, so I think the logical side of my argument would be we have to listen to medical professionals, right? If even the president, who's not even following his own advice, says you have to have 14 days of decline to be considered safe to reopen, no state right now is in that position. We at least should be following that, right? Because otherwise you're going to have another spike. And some of these states are going to. I guarantee Florida and Georgia and Texas are likely to have another spike. And it's going to prolong the pain for all of us. But I understand. I want to be able to see people again and do things, but I want to do it without making my neighbors and my family members and my customers and my constituents sick because of it, right? And I think one thing I'd really say, I understand some people who came to that rally last Friday did it out of fear. Some were politically manipulated because there was some political money trying to reinvent the Tea Party, movement again. But I think a lot of people also would like to reopen, but we understand we can't yet. Right. So we've got to wait until we get those numbers down, which I think the peak is about 7 to 10 days away still in Wisconsin. And then we should be on that decline. But that's when it's going to be safe. But there's not a lot of business right now anyway. I mean, I saw a survey, 80% of people said they wouldn't go to a restaurant right now if it was open.
Yeah.
So, if no one's going to actually utilize this, you can't run a restaurant, as with your background in business, is that you can't run a business at 20% or 40% as a restaurant because you run on low margin but high volume, and it's just not going to work until things are better. So, I understand the want for business to come back. I mean, I'm feeling the pain bad for my own business, but I don't want my employees to get sick. I don't want my family members to get sick. And in my political role, I don't want my constituents to get sick.
All right. 2 more questions for you, Congressman. I'm going to let you go here. One is I want to talk about taxes. And the second, I want to talk about how this is impacting people of color at a high rate. And let's start with that first. Let's start with the people of color thing first. So we know in Wisconsin, I think this is impacting maybe 25% of the Black community, 24% of the Latino community, and this has had a real impact on the community, not including people who are working, who are losing their jobs, talking about getting back to work. Those people who are going to be unemployed or have businesses, it's going to take them a long time to ramp back up. Is there anything you think we can do specifically to help communities of color? I know the PPP program put up maybe $30 million or $30 billion towards that.
We started to in that second amount of money that came out.
Yeah. So is there anything you think we can do to focus on that even from a long-term strategy? Because if something like this happens again, we can't afford for these communities to be hit this hard. So I know you're someone who thinks about these things. What do you think we could do, some of those solutions to address those?
Yeah, and I've been working with Gwen Moore right now on some of
Oh,
this in Wisconsin, right? Because
yeah.
what we're finding out across the country, but certainly in Wisconsin, that certain populations, African American population, Latino population, are being higher impacted. I think it's showing us a lot of things, right? In some cases, it's some of the conditions that are tougher. If you get it and you have that condition, you're going to have a worse outcome. In some cases, it's things like the population who's working in the meatpacking industry is largely
Right.
Latino, right? And they don't have the safeguards, and that's part of why we're seeing the spike there. So I think hopefully what we're learning out of this is, one, there's already huge income inequality and other issues based on race, including in places like Wisconsin, we have to address. But then secondly, in this specific area, we really got to make sure that we're addressing the needs where people are seeing spikes. We got to be very specific to dealing with those communities of spikes. We got to recognize the fact that in some cases, the people who are getting this are the people who still have to go work in a grocery store or a meat packing industry.
Right.
And we've got to have protections for those folks, or else we're still not safe across the board. And I think Milwaukee has actually done a good job of keeping statistics that they don't have in other communities. And because of it, Milwaukee actually may turn out to be one of the national kind of tests that we're going to look at to figure some of this out.
Oh, that makes sense, right? And
Yeah.
kudos to Milwaukee actually keeping the data around race. I mean, that's
Yeah.
something that everyone should have been doing, in my opinion. And,
Right.
and last question for you: taxes. Tax season came, and it's I know with you guys extended to when taxes can be in. What happens? 'Cause I'm guessing that this is going to impact people who can pay their taxes, right? Like I'm guessing that it will. Like, have you guys had discussions about what happens if people who are laid off, who can't pay their taxes, like what does that look like for the average day person now that they might not
Yeah.
have the income?
Well, most people actually get a refund, right?
Okay.
Because when you get your taxes taken out of your check, generally there's enough that you get a little refund. So I think some people might have did that pre this really spiking, right? Because you got your W-2 at the end of January. For those of us who wait longer, I just noticed I had to pay in a little bit to the state and federal, and they did just cash the checks. So those, at least they're processing things and they're doing that, but people have till mid-July. So for people who owe, who might have, now need the money for other things, that
Right.
could be an impact, and we're going to have to look at how that's going to be. The good news is that we're trying to look at all sorts of issues, like people can't afford rent or mortgages in many cases right now. We can't have people being evicted, right? People can't pay their student loans back. So we've got a 6-month moratorium on that, including no accruing interest during that period. So we're trying to look at all those sorts of things because unfortunately, this isn't going to end real soon. Now,
Right.
yesterday there was some great news that came out though, Henry. I've been following Scott Gottlieb, who's the former FDA commissioner, the first one under Trump. So he works for a conservative think tank, and he's one of my go-to guys because he's just a good prognosticator of things. And there was a drug that he's been saying for a while he thought would have some positive results. And just yesterday they got their numbers back, and Dr. Fauci talked about it. It shows that for people who are in higher risk areas, so if you're older or have any of the other conditions, heart disease, diabetes, etc., it shows if people get that early enough, about a 30% reduction in time suffering from the disease. And towards the later part, usually that first week, you may not have as intense symptoms and it gets bad. And that's when people have had to be put on ventilators. So what we need are some of these therapies in place, especially by fall. We now have a promising drug. And based on that, probably we can look at a class of drugs. And then we're going to figure out how the antibodies work. So there also is some promising stuff happening. But we got to understand that for a couple months, it's going to be most of May yet before we actually get through this safely. And if we do that, we're going to have deep, like depression-like conditions for a couple months. But because of it, we'll come out of it. And we've got all kinds of other things that are good on the horizon. But if we try to get back too quick, like Georgia and Florida and Texas, that's when you're likely to have another spike. And then what are you going to do? Close down all over again? That will kill many restaurant owners I know, many retail owners, many manufacturing is down right now in many areas. That would be the worst thing that could happen.
Yeah, even think about if the spike goes back up and then you can't open back schools, right? So schools are huge. Like for me, I'm a parent who's homeschooling. Schools are a daycare, the education system. You can actually work.
Exactly.
So if the spike goes back up and kids can't go to school, my gosh. I mean, it's going to be a long, long year for a lot of people. So
yeah, no, we're all in this together. We just got to be smart. Follow doctors. Don't follow reality show stars or politicians or combinations thereof. And if we do that, we're going to be a lot better off. So, Dr. Fauci, put him on TV every day. Donald Trump, let him watch TV every day. It will be a lot better off.
Congressman, I'm starting to get a theme here. You sound like you don't like our president. That's what I'm.
I'm a little undecided still, but the fact that he's killed almost 60,000 people, I think I'm starting to not like him so much.
Well, there you go. There's a theme there. I just say, but okay. Hey, but sincerely, thank you for all your time. Thank you for joining us for Real Talk, and please be safe. And thank you for being a champion for Madison all the time. You've always been a true champion and advocate for what we do here. People love it or hate it, he does represent Madison. I mean, he is the typical Madison guy. He really is. So thank you, Congressman, and thank you for all you're doing. I hope we'll see you again soon.
Great. Thanks, Henry. Appreciate it.